let's talk about the hate.
On my way to week 5 of my surgery rotation, I'm gonna try and catch an AV fistula creation. It's with one of the vascular surgeons that I really liked. And then depending on if they're running behind or not, I might try to round on some patients either before the surgery or after the surgery. Some quick procedures today. First, I went to an AV fistula with vascular that was placed for dialysis. Second, I went to do a Mediport placement for someone who was going to start getting chemotherapy. The third procedure I was supposed to go into it said it was going to be an X-lab. It's actually just closing the abdominal incision and the old stoma port and some other incision that had the drain in it, so it's just like closing everything together. There's basically too much tug on both sides of the incision, so the surgeon determined that it was going to be a difficult closure and that the patients actually will need an abdominoplasty, and that's going to be with a different surgeon. So that was also quick overall. And the rest of the day I rounded on patients, studied a little bit, and now I'm back. I'm very exhausted. I did not get enough rest this weekend. It's a beautiful, beautiful day today. My biggest pet peeve with UWorld this year is when I'm reading the patient presentation and it says, on physical exam, the patient appears comfortable, no distress. And I'm like, okay, I factor that into my decision. Then eventually when I answer the question and I get it wrong or right, and I go look at the explanation, in the explanation it says, obviously there's airway obstruction, airway compression, if we see the patient in a tripod position. I'm like, tripod position? Did I miss something so significant as a patient tripoding? So I go back, reread the paragraph, and it says, patient appears comfortable. So why the heck in your explanation are you telling me, obviously if you see tripoding, you're concerned for their airway and their breathing? There was no tripoding. Why are you telling me this? Coming back from clinic was really nice, very laid back. It's like 1 to 4 students usually in the attending, and we take turns seeing the next patient. And then in between you have a little bit of time to study. So I enjoy it. I think it breaks up the rush of OR days a lot, but I'm so exhausted. I don't know what it is. I think it's my sleep. I think I've just been getting really bad sleep for the last 2 weeks. I just either can't fall asleep early or I keep waking up throughout the night, just not comfortable sleeping. And so for the last 2 weeks, I've just been so perpetually exhausted. It's 6:30. I'm on my way to work. Feeling so much better today. Yesterday I crashed doing UWorld questions in bed, took a 2-hour nap, finally feel like I got some decent sleep tonight. Feeling good, and I'm ready for the day. Today is also going to be thoracic surgery day, my favorite. Hopefully I'm set up to have a really nice day. Finished got to hold the camera the whole time, which was really nice, and then helped close the portholes. So good experience, and I'm headed for the second thoracic surgery now. Early end to the day today, which is really nice. I love surgery. I'm really excited to have long surgical days, but also I still like every now and then having a short day when I can get the rest of the day to study and do my own thing. I watched 2 thoracic cases today. The first one was a hiatal hernia repair laparoscopically, and they let me hold the camera the entire time, which is one of those things that I'm always so grateful for because it gives me something to do, and Obviously, it's a skill that I am training in, so it allows me to practice. But I actually found myself today having to remind myself to be grateful about all these little opportunities that I get to participate, because obviously it's not like a granted or a given thing that I'm going to get to do something, because they still have to do their surgery efficiently and well, and the fact that they let a med student even like hold something, I should be grateful for. And today I found myself thinking about how oh, can I at least get to suture? I feel like I didn't get to do anything in the surgery, and it would be nice if I could at least suture 1 or 2 portholes. And then I was like, dude, the first week that I had surgery, I was literally grateful when they even let me scrub in just so I could stand by the table, just so I could see something. But yeah, I basically just caught myself being expectant to do something, and then I remembered that I should continue to be grateful that I'm provided these opportunities and given the responsibility to suture something up or hold something or whatever little thing they let med students do. So the first surgery today was a sliding hiatal hernia, and it was repaired laparoscopically. What we did is we used the pleura because, as a surgeon was telling me, the pleura is strong, and if you have enough of it, you can basically sew it together, and it's going to be strong enough to prevent the stomach coming in through the hole, versus when you don't have enough pleura and then you have to use something like mesh. So what he did is he freed up the GE junction, and the stomach could really easily see the hole in the diaphragm. It was probably about 5 centimeters with the esophagus and the stomach coming through. Pleura that he had freed up on either end, he brought together with some sutures and sutured it back, making the hole just enough to where the esophagus would be able to still go through, but the stomach was now below the diaphragm. And then the second part of that procedure is they do a gastroplexy, so they sew part of the stomach to the abdominal wall, and that way you basically get dual protection from the hernia coming back. You have the pleura and the stitches holding the hernia down and preventing it from moving cranially, and then you have the gastroplexy holding the stomach to the abdominal wall caudally. Once that was done, took out the ports, I helped suture them closed, and we were done with the first surgery. Second surgery, we had a thymoma resection. This was done robotically, and pretty simple procedure. You make the portholes, you put in the ports, you bring in the robot, you go in. The mass was very clearly delineated, probably also about 6 by 6 centimeters, and he went in and cleared the margins around it and basically cut it off. And as I learned, an easy way to memorize the anterior mediastinal masses, there's 4, and it's the 4 T's: the thyroid, the thymus, a teratoma, and a terrible lymphoma. And so in this case, it was thymoma. After that, I helped suture up the portholes as well. With the robot, there's definitely a lot less for a medical student to do, so if there is a robotic case, usually what I do is I bring in my surgical recall book that Becca gave me to read, so I can study while I watch the case, but I don't scrub in until the very end, because in the beginning and in the middle, there's really nothing I can do. When the robot is brought in and you have the PA and the scrub nurse, there's literally no more space at that table, and there's nothing I can do anyway because they don't let me move the arms of the robot and switch the arms or anything like that. I think it's a good idea to just pull up a chair and study something on the side, because you're basically watching the surgeon do the operation on the TV anyway, so you're watching the TV and you're studying at the same time. Of course, if they allow it and they don't look down on you trying to study in the process, but I think for the most part they're very understanding and understand that medical students have to study, and they're totally okay with that. And then I just ask in advance if I can scrub in at the end so I can help close the portholes. I love the sun so much. I've been deprived, so this is pure bliss for me now. This moment. Had a bit of a later schedule today, so I was able to do all my UWorld questions, and I did 250 Anki cards, and I plan on doing more. Nowadays, I've been averaging around 200 cards a day. But also the thing that I wanted to say is originally I didn't have these subfolders for the different rotations, but I started to really fall behind with my surgery cards, and especially my IM cards, and then they got mixed together all in the main deck. So I separated them out, so at least now I can finish all my surgery cards, all the miscellaneous cards for the day. And then I gotta work through trying to get through all these IM cards again. Let's talk about the hate. I'm really fired up about this right now, and I've like calmed down a little bit, but I'm still so angry. I literally don't think I'm gonna be able to sleep, so this just plays into my whole sleeping problem. First of all, medical school is such a cesspool of gossip and rumors. I've never encountered this much gossiping since I was in middle school, and then I came to medical school full of adults, grad school adults learning to become a doctor. The amount of gossip that I would hear on the daily is just atrocious. So if you're going into medical school, get ready to hear rumors flying about you and everybody else in every which way. So I've heard a lot of things about me for a while, and I'm not the type of person to really like give it a lot of time and to like sit with it for a long time and let it eat away at me, because rumors are rumors, and what matters in the end is what I know about myself, what I believe about myself, and the only people that I care about knowing what's true and what's not true about me are the people that I love, so my really close friends. So if someone thinks something different of me, I'm not gonna go out of my way to like dispel that random rumor. I've heard rumors about me getting yelled at by attendings. I've heard rumors about me getting into trouble. I've heard people literally spend their weekends getting drunk and making fun of my YouTube videos on their weekend. Like, you literally have nothing better to do with your weekend? Like, that's the only free time you have in medical school? That is so flattering. I don't think my life is that interesting. I really enjoy running a YouTube channel and connecting with people and sharing my experiences, because YouTube is a lot of the reason that I got into medical school, because I saw the examples of other medical students on YouTube, and I became more and more interested in the idea of medical school, and I got to learn a lot about medical school through it. So it has a really special place in my heart. If you are in my class and you're watching my videos and you're making fun of them, I just feel like if you don't want to watch, you probably have better things to do with your time, so why are you watching, you know? And it's just crazy to me, like, I came from Maine, okay? There's not much going on over there. The school is like one of the only things in the area that we have, apart from like maybe like 2 bars or whatever, like the 3 restaurants that everyone would always go to. So of course I kind of understand that you literally have nothing else to do, you just like gossip about people. But now we're all separated, everyone went their own way. People are all the way from Philly, New Jersey, all the way back to Maine. Like, we're all scattered. We work 9 to 5 jobs, if not longer hours. You really have time to come home and fill your head with gossip about other people and spreading that gossip around to other people. Because personally, when I wake up at 6 in the morning and I come home at like 5 p.m. and then I eat and then I go to the gym and then I study and then I go to sleep, there's no time for me to think about some random rumor that I heard about you getting in trouble with your attending at some point during your first rotation. Especially with my weekends that are my only free time that I use to like pile in all the possible fun that I can. My channel has grown a little bit like more in the past couple of months than it has before, which is exciting because I feel like people are joining because they feel like they have something to gain, right? Like they can see into an experience, they can compare it to their own experience, or they can be inspired to go into medicine or whatnot. I just hear so many random things come back to me about things that people hear that they think happened to me that never happened to me. Some like weird, outrageous thing. Bro, you probably have my number. If you're gossiping about me and you're in my class, you most likely have one way or another of contacting me. You can text me, you can ask me, okay? And I can let you know. At this point, I'm literally scared to put out another video just because I feel like next week there's gonna be some weird new rumor that I'm again gonna have to dispel to like my friends and the people that I care about when they ask me about why I didn't tell them that this random thing happened when it didn't happen. I'm so curious where these rumors come from. Like, who has the creativity to make this up? And then what is the like agenda? What's the motive? Do you just want to spread lies about me? Like, is this fun? Like, are you trying to get clout out of it so you can like share it with other people? I'm also very open. Like, I usually have no, as you can tell from my like YouTube channel, have no big reservations about like sharing things. I'm honest about what I put out. And so it's crazy to me that like something that I'm doing because I enjoy and something that I'm doing because I'm hoping that there are people out there that this might help, there are people that see that, and I guess in their heads they're like, how do we tear this down? How do we make this a bad experience for this person when she really enjoys it? Like, is that what goes through these people's heads? Like, I'm really just trying to understand. Find a different hobby than spreading wrong rumors about me. If you need ideas for what you can do with your weekends and your free time, hit me up. I will give you some ideas. How boring is your life wherever you are that this is your main form of entertainment? The other thing is, like, I really try not to let these things get to me, and I do a pretty good job of it. And this now is the accumulation of hearing so many things about me throughout the last 2.5 years. So this is not the first time, but this is the first time I'm addressing it because I'm getting tired of hearing about this. I'm getting tired of hearing about my name coming back to me across state lines at this point. Not from the same state and town where everyone gossips. Now I'm hearing about gossip coming all the way from different states, like a celebrity. Like, I never wanted this celebrity status, but now I have it. And I'm sarcastic through a lot of this because just how I like cope, and I always put a little humor into situations like this, but at the same time, it is kind of a bummer to hear things about me when I'm just trying to do what I like. And like, this year has been off to a really good start for me. I'm doing really well on rotations. I'm learning a lot. I'm getting a lot of really good compliments and feedback, and then I hear something like this and it like ruins my week, you know? So yeah, I guess that's it. That's all I wanted to say on that. Good morning. It's 7 a.m. headed to the hospital. A couple of different options for surgeries this morning. It's a pretty heavy surgery day in general, so there's a lot going on. But this morning, I was either gonna go to my first ortho case and see an olecranon repair, or go to an X-lap. But I haven't read up on that patient yet, so I'm not sure what the X-lap is looking for exactly. So I have that decision to make before I get there.
Symptom is going to be exertional dyspnea.
My new favorite words are, you've had a long day today. Sleep in a little bit tomorrow. Don't come in too early. Another really long day today. I came to the hospital at 7:30 and it's 9:40 and I'm finally leaving. I had kind of a weird day today overall. Like, I wasn't really in a good mood. Rounded on some patients that I had from prior cases that were just sad cases, and I think just everything all together put me in a sad mood. My schedule today was kind of all over the place. Like, I almost like didn't know where to go or what to do with myself today. I think halfway through the day I was a little sad that I didn't get to be in like a bigger and longer surgery today. And then be careful what you wish for, because I went into a surgery at 4 thinking that it was probably going to be like 2 hours. I left at 9:30, so I was there for 5.5 hours and they were still going. Super interesting case though for me. Something that I've never seen before is when you open an abdomen and there is just pus, like yellow, gooey, so much pus and blood, and I've just never seen that much pus come out of like an abdominal cavity before. It was supposed to be an X-lap, so an exploratory laparotomy for a small bowel obstruction, and I can't even explain what the inside looked like because I don't even have the right words to explain, but it almost looked like something had either like exploded or ruptured, then got all over like the small bowel and the colon, and then got inflamed, and then got adhesed as like a thick layer of pus. So there was almost like these weird adhesions of pus, blood, and extra tissue all over the intestines. And so we suspected a perforation, so we looked for a perforation and didn't find one. But there was a part of the colon that was fibrotic, so that was taken out. This person now needs a colostomy bag. There was a part of the omentum that had abscesses in it, which I also didn't know could even happen. So we did an omentectomy. I don't even know if that's the right word, but we took out a part of the omentum. So very interesting, something I've never seen before. So I've learned a lot throughout this case. So I'm very grateful for cases like that, and that's one of the reasons that I like the longer cases, because I feel like there's so much more that I can learn, and I'm very grateful and appreciative to learn all these things. I also had the most quintessential experience as a medical student today. Week 5 of surgery, it finally happened to me because I basically just held retractors for those 5.5 hours, and no problem. Like, I am happy to do it. You know, I go to the gym for a reason. No, but actually, like, whatever gets me to scrub in and be close and learn and be a part of the team and help, I'm very happy to do. But it's so funny because med students always joke about having to hold retractors for forever, and I was literally like balancing retractors in all these different positions. Yeah, so yeah, long day, fun day, and thank you to my attending who said that I can sleep in a little bit tomorrow and come in a little bit later, which I definitely will take advantage of because it's still gonna take me like 40 minutes to get home. So let's go. I got to the hospital at 10 today because I was allowed to sleep in, so I took advantage and just changed. I'm gonna go grab some coffee and then head over to the small ORs for the small procedures. The 2 minutes of sunlight that I get walking from one building to the next. Quick time with my attending. I have my giant list of patients to see, so I'm gonna head to the other part of the hospital now. So my patients are post-op, but I am going to see 2 new consults today also.